Munkize nange nyongereko katono. Obwe byange mbikoye.
The Bachelor of
Dental surgery.
a Bachelor of Dental Surgery. So the examples we have: clinical services, the head of reproductive health and child health, national health laboratory and diagnostic services, emergency medical services, communicable diseases prevention and control, Uganda Medical and Dental Practitioners Councils. We have examples of positions in Ministry of Health and departments which do not require a Bachelor of Medicine and a Bachelor of Surgery. And we have examples below which can be occupied by other cadres in the health profession. So we have Environmental Health Department, Pharmaceutical and Natural Medicine, Multi-sectoral Collaboration and Partnership, Nursing and the Midwifery Council, Allied Health Professionals Council, and the Pharmacy Board. The Ministry of Health ensures that each position, as mentioned above, is filled by the most qualified and skilled professional. For example, the head of nursing must be a nurse professional. The head of pharmacy must be a pharmacist. The environmental health office must be headed by someone qualified in environmental health by training. More examples are the National Drug Authority, the National Medical Store. The pharmacies in the whole of Uganda are headed and supervised by pharmacists because their scope of practice is in that area. In departments with multiple health professionals, leadership roles are typically assigned to the most highly qualified and skilled individual. For example, radiology is headed by a radiologist, laboratory services by a pathologist or a microbiologist.
The health sector actually is quite wide, and it needs a lot of collaborations from the different partners and the different people who are trained. So it means that we are not saying that only doctors should be able to treat patients alone, but we need everybody on board. But then there are also positions that actually should be, they are not actually, I shouldn't say ring-fenced, they are not ring-fenced, but I think they need specific requirements because of the two components that are needed. One, the technical or the technocrat, the technical advice that should be available or availed, and then two, the managerial. And I want actually to echo to the entire country that actually in the health sector we are usually very partial in that we have different cadres and different levels of leaderships. Because if you look at a strategic level, if you go to Ministry of Health, you realize that there are doctors there, and there are nurses, there are pharmacists, and the commissioners in different areas. So that means we are very partial in whatever we are usually allocating in terms of jobs and the rest.
We are going to appeal this case and we are going to win it. Make no mistake about it. Justice delayed can be said to be justice denied, but even cases which have been wrongly judged or misjudged can always be resurrected and won after decades. We've had people who have been on death row for years and their cases are re-argued, and when new evidence is produced, the rulings are overturned. I have only 6 points to make. One, this appeal to the Equal Opportunities Commission by our colleagues, the pharmacists, et al. I don't know, the list is very long, but especially by the pharmacists, is an extrapolation of their attempt to grab titles, which I don't know whether successful or not. Their title grab, which they did in a general assembly, in their general assembly in 2017. Munkize nange nyongereko katono. Obwe byange mbikoye.